Good morning and welcome to our Supporting Heart Health program, a cardiovascular disease and atrial fibrillation webinar. My name's Helene. I'm the Workforce Development Officer here at the PHM, and working alongside me is Katrina, who's also in the Workforce Development team. I'd like to begin by acknowledging the traditional owners and custodians of the unceded lands and waterways. We recognise their diversity, resilience, and the ongoing place that First Peoples hold in our communities. We pay our respects to the elders, both past and present, and commit to working together in the spirit of mutual understanding, respect, and reconciliation. We support self-determination for the First Nations peoples and organisations. A little bit of housekeeping. You can view the majority of our webinar recordings freely on our PHN Learn YouTube channel, and the link to that will be up on the screen and into the chat. Please see our upcoming events on the screen now, and you can register for these events on our website, and the link is also there in the chat. Please make note of the West PHN Health Pathways relating to this topic, and that's on the screen at the moment. Many of you should be familiar with the Health Pathways. It is a free online resource with localised clinical and referral information for health practitioners. And you can see the pathway related there on the screen. A certificate of attendance will be emailed to participants, so please take the moment to check that your full name is displayed accurately on the screen. If not, or if you're unsure, just rename yourself or type your first and last name in that chat box. This will ensure that we get the certificate to you. This event is being recorded, so please keep yourself on mute unless you would like to ask a question during the question and answer time at the end of the formal presentation. We encourage interactivity and discussion, so please feel free to type in the questions in the chat box at any time. Your feedback is important, so if you can take the time to complete the survey after the webinar, and the link will also be in the chat. Our presenters for this evening are Dr. Jennifer Coller, cardiologist, Eugene Lugg, specialist Pulse Point Academy, and I will now hand over to Laura Martin from Western Vic PHN, who will take control of the meeting. Thanks, Laura.
Would like to thank you all for joining us this morning. I am the Senior Manager of Population Health Planning and System Redesign. And what we have done is partnered with PulsePoint to put together a small program related to supporting general practices in supporting them to support their patients who have heart failure and also atrial fibrillation. So I will talk to you a bit about the technical parts of the process, in the sense of the filling out and completing the expression of interest, and the steps that we'll go through regarding that. And Dr. Coller and Eugene will speak to you about the program itself. Luckily for us, Helene has covered a couple of my first slides. I too would like to acknowledge the traditional custodians of the land upon which we meet and pay my respect to their elders past and present. I am blessed to be on Wadawurrung land, and have been since the day I immigrated here. So I thank the custodians for looking after this beautiful land for me, or so that I could benefit from it now, I suppose. Helene has covered our housekeeping. So largely what we'll do is we'll talk a bit about how this program came about, a little bit about, well, hopefully a fair bit about the model itself. Then I will cover the EOI process and some next steps, and then we'll have an opportunity for questions at the end. And as Helene mentioned, if you do have questions, you can type those into the chat box, and we'll try to answer those as we go, or make sure that we cover them certainly at the end. This whole session will be available in a number of places, so always on the Westvic PHN Learn channel, but we will also have it on our opportunities, EOIs and opportunities pages for the Western Victoria Primary Health Network's website, because this is an official expression of interest. We have certain processes that we need to work through. I don't think I need to tell any of you, because you're at the front line, that how important it is for us to try something maybe slightly different, or maybe figure out how to connect some of the pieces when it comes to cardiovascular disease. And we as healthcare professionals have been talking about it for years and years, and we've been trying to do our best about it for years and years, but we unfortunately haven't been able to make any significant impact. What we see in Western Victoria is that although our numbers of cardiovascular disease are quite similar to the rest of the state, our outcomes are worse. And there's likely to be numerous reasons for that, but one of the ways we wanted to explore addressing this concern with this program is in supporting you in your practice to be best prepared to help your patients during their journey. And that's why we chose Pulse Point Academy to work with you, because besides the fact they're a great team, but they're quite knowledgeable. They're very up to date and current on best practice in cardiovascular disease. And I think Jen may say this later, but Jen's also quite familiar with our region. So she has a little bit of a tender spot for what it's like to be in regional Victoria. So that's always a bit of a bonus. So we really want to look at how we can best support practices, which is why some of the details were perhaps a little vague. And I think about the specific programs. And Jen and Eugene can talk to you more about that as we go into this. So we'll cover this section, and then I'll talk about the actual EOI process. Thanks, Jen. I think this is you.
Thanks so much, Laura, and yeah, for everyone who's joined us today. And I would like to just start off by acknowledging the traditional owners of the land on which I am coming to you from today in Shepparton, the people of the Eora Nation, also Bangarang people. So, and just pay my respects to elders past, present and emerging. So just a little bit about our team, because Pulse Point Academy has been established since last year now, and we're very grateful for this collaboration with PHN and for all the work that Laura and her fantastic team have put into this, to preparing this and bringing it to you today. So a little bit about myself, as Laura mentioned, so I'm a cardiologist. I'm based in Shepparton. I do have quite a love for regional kind of based cardiology, and that kind of comes about from being initially trained in metropolitan Melbourne, and spending a lot of years there, but also actually spending quite substantial periods in regional Victoria. There's not many areas I haven't worked or studied in, and I think I worked out today I've definitely spent almost pretty much a year in Horsham, based in Horsham, either as a student, an intern in the emergency overnight over a very hot summer, and then later as a locum physician. But I've also spent a cold winter in Ballarat as well. So I've seen kind of the two ends of the spectrum. So I was, as I said, rotated out to a lot of regional areas and saw that there were quite similar issues that could arise, and then also doing my cardiology training later in Melbourne and seeing that some of the outcomes that came from some of the delays in transfer and just some of those barriers that people were facing, and really finding that, you know, I felt that we just needed to do something a little bit different and approach things in a different way, I suppose. So I've also spent, so I relocated up to Shepparton from my metropolitan-based practice 3 years ago after spending 8 years visiting Shepparton. And I suppose that Pulse Point Academy has come about from really kind of spending 3 years, really spending time trying to understand in depth what are the issues on the ground in regional Victoria. Clearly, those do vary from location to location, and particularly with certain distances presenting more of a barrier than others, and location of specialists and GPs. But there are some very similar aspects that I'll talk through in a moment. So I'll tell you a little bit about Eugene as well. So he is he started out his background in he's our director of strategy and operations, and he started out his career working more in cardiothoracics, then went on to work in chronic disease management, and really at that kind of pointy end, visiting people at home and actually working out what were the issues that might lead to further hospitalizations with heart failure and AF, and really working closely with those patients to really improve outcomes for them. He then went on to work at the Heart Foundation, and later drove some really successful statewide quality improvement initiatives in cardiovascular with Safer Care Victoria before joining our team. So I guess collaborating together, we've got, I guess, the background more in kind of cardiology and cardiology education, which I think is very important, but also that real understanding of the chronic disease management and that interface with the patient in the community as well. What I didn't mention also is that I spent a lot of time embedded in primary care clinics over this time, working really closely with the GPs and understanding more and more about what were the issues that they could be facing on a day-to-day basis, that they kind of grab them in the corridor and say, oh, look, they've got this patient, there's this issue today, or what do you think about this? And really kind of understanding a lot more about the issues with getting people to care, or the issues where perhaps there could be a little bit more of support of like interpreting a test and that type of thing. Laura, do you mind moving to the next slide, please? So with all of that in mind, and I guess with a lot of impact that we've seen by taking this approach of really engaging with education across the Shepparton Golden Valley area, and quite a big area, that it's a catchment of about 120,000 people. We've really seen some significant improvements in the cardiac outcomes for patients and getting the care where it's needed. But I guess that's been working not only just with general practitioners, specialists, but with practice nurses, with the local district nurses, the Aboriginal liaison officers, and health workers. So I guess how Pulse Point Academy came about was really trying to understand and understand and bridge some of these gaps, particularly for some of the more remote areas that really can face more barriers than others that are perhaps located a little bit closer into a metropolitan region. So our mission at Pulse Point is to really elevate kind of quality cardiology care across Australia. So by providing really strategically provided programs, both with digital online courses that are really accessible and quality improvement programs, and those are tailored really to the individual location. But we're just taking a really whole of workforce approach. We're not just saying, okay, we want to provide education to general practitioners, and that we're expecting that general practitioners will take that burden on and really, manage things by themselves, because that's just not realistic, and it's not fair, because we know that there's so many pressures on general practitioners across the state, and it's that's only increasing. So we're really looking at also supporting patients right through their journey by actually engaging with people out in the community who are providing chronic disease management programs, district nurses, nurse practitioners, all across the physiotherapists in cardiac rehab. And some of those issues that we see are just that sometimes difficulty in discussing with patients issues, difficulty just feeling less than confident in engaging with patients with confident discussion. So what are the challenges? So primary care demand is huge. We know that I'm sure it's just as challenging in Horsham and surrounds as in Shepparton and surrounds. So it can take some weeks for patients to get into a GP clinic, and then it's difficult for patients necessarily to be seen in a very short time frame with specialists and with specialists, or even get into cardiac rehab. There might be a 6-week, 8-week wait for cardiac rehabilitation. So there's lots of opportunities for us to intervene and provide really excellent care in those periods where patients are waiting, to actually optimize their treatment, empower them with understanding an action plan and when to seek earlier care, and potentially avoid hospitalizations, which, you know, we see across the state a lot of contributions of readmissions from heart failure and AF is with the data that Laura presented earlier. So additionally, there are lots of, you know, long wait lists for specialist appointments, and then there are statewide referral guidelines that focus mainly on kind of severity. And so there are patients that can be quite fragile and tricky to manage that can really benefit from that care locally. There are also patients that just literally can't travel because of barriers to access to transport. They can be elderly, have mobility issues, or outright just not want to go to a larger area. So really focusing on how we can provide that care locally is important and really important to the patients as well. And that's a lot of feedback we get constantly about how people are so grateful being managed locally. So new therapies and interventions, there's been a huge change over even the last 5 years in the treatments we have for heart failure across the board, and also atrial fibrillation, particularly not just focusing on rate control only, but looking at strategies to give people better outcomes by potentially thinking about things like atrial fibrillation ablations. And that can be tricky to make those decisions, but if we can make those decisions early in the course of the patient's journey, then that can make a really big difference to not only them, their quality of life, but reduce the risk that they're going to actually go back repeatedly to the emergency department, and not be necessarily being escalated to the care that they need early on. And there is complexity. So we talked about, you know, should we concentrate mainly on heart failure or mainly on atrial fibrillation, but there's the two together, and it's difficult. You can't just focus on one disease without kind of talking about the complexity of the interaction, because heart failure and AF do co-occur very frequently, and also with other comorbidities like kidney disease, all of those things, and coronary disease as well. So I guess we do, Eugene's going to tell us a little bit about the courses, but we've developed some courses, and we will be building on that knowledge and information over time. And obviously there's opportunity for us to hear what's needed as well, if there are additional things that people wish us to kind of to cover as well. So I'll hand over to Eugene at this point. Thanks, Eugene.
Thank you and good morning. So I get to go through the exciting bit, which is what the program's going to look like. So we're looking at a 6-month program in collaboration with the PHN. So first, the online expression of interest event, and you're here. Thank you for joining us. The first part is really a virtual scoping and planning meeting. So for those clinics who come on board, we really want to understand your setting, what your challenges are, what your opportunities are, and I guess where you've had a track record in some of these sort of managing chronic diseases in different ways. And then from there, start to build what you might like to focus on, where are your education needs, where is the opportunity for improvement, and then start to plan that out. How might we be able to measure that? Let's define the problem, and who do we need to bring on board to I guess, drive change. Then to facilitate the knowledge development, to make sure that We're up to date with our knowledge in heart failure and AF management. We have designed 2 courses in atrial fibrillation and heart failure management, which will be available to you and your teams that participate in the program. You'll have access to, I guess, the latest guidance on how to manage heart failure and atrial fibrillation in the community, and that access will continue for 12 months after the stage in which you first register. As Pulse Point unfolds and as we get to know more and more about the needs of the sector, there's a high likelihood we'll continue to add different offerings to those courses over time, and you'll be notified. So you might get additional content over the duration of the 12 months after you register. We'll then be offering support calls where myself and Jen will be following up with you and your team. How are you going? Do you have any specific education needs? Is there something we need to focus upon? Is there something you need to tap into Jen's expertise in understanding a really nuanced part of atrial fibrillation or heart failure? Or do we need to really focus on the quality improvement processes? The next side of things is actually a site visit where we'll come out and visit you. Again, understand your context, the way in which your patients interact with your service and where the opportunities are and the challenges, and then get to know a little bit more about your team and what's happening. All the while, we'll be offering you support. So if you needed support via email or phone, we're always available. At the end of the 6-month program, we're going to get together for a forum. This forum is another opportunity to deliver content to support you in the development of your knowledge and skills, but we'd also really like to bring in some support services in your region to make sure that clinicians working in primary care are aware of some of the local services that are available to actually support their patients, to understand what's on offer, what are the referral process, how do you actually go about getting your patients for this support. In addition to that, we're going to also have an online event where the primary care clinics that have participated will have opportunity to share what have they done, what have their outcomes been, and I guess share with each other so that we can spread what some of the learnings have been over the duration of the program. So yeah, an exciting program, really looking forward to launching this and to working with the region. I'm going to throw back to Laura now, please, to understand some of the other offerings.
Thanks, Eugene. And to help bring all of this together and I guess to round out a little bit of the program, we're very well aware that this will take time. That taking the learning modules will take time. Having Jen and Eugene meet with your team, that's going to take some time. And so we're able to offer the participating practices $5,000 to help cover that time expense predominantly. And what we're just looking for is your full participation in the program and, some good, honest feedback about how the program's gone. We also, at no cost, if your practice isn't already using the GoShare platform, we will offer you or connect you, link you in with the GoShare platform, which will bring together your patient health literacy and learning packages. Those packages will be pulled together by Jen and Eugene, and I think I saw Will online. Will, who works for the PHN, but is our liaison with GoShare. So they'll work on pulling those packages together. We're also doing our best to put in an automated assistant approach to those learning packages so that everything isn't just a video or a document to read, but that there's some AI assisted but script-driven options for patient learning packages. All of that platform is going to be branded with your general practice. So when your patients receive this information, it comes with the branding and contact information of your general practice. So they can easily associate this with their condition and the reason they're one of probably many reasons, honestly, that they're coming into your clinic. Additional to that is we have established in the GoShare platform a patient-reported outcomes measures, which is a simple 5-question patient outcome survey that will go out to your patients. I think we decided 3 times. I'm sorry, I have, this has been a long time in works, but I think it'll go out 3 times, minimum 2, to your patients so that we can get some outcome measures about the process, and also so that you at practice can keep an eye on what's concerning your patients and where they might need a little extra support. So we'll move on to the expression of interest. And I have just changed the date or the time on that QR code. So it will open at 8 o'clock. You can access the form, even though I won't have all of the documentation posted on the website for you to access until after 12 o'clock today. You will be able to access the form. We will put in to our EOIs and opportunities page on the West Vic PHN website, the link to the form, the link to these slides, and the link to the recording of this session, so that if there's anything you need to go back and check, or anything you want to go back and check, or if you are attending on behalf of several clinics and you want someone else in the clinic to see the information, or you want to pass it on to someone else in your clinic, you can direct them to one spot to get all of the same information that you've received. So all of that will be ready after 12 o'clock today, but in a couple minutes, if you do decide to scan the QR code, you'll be able to see the EOI form. It's fairly simple. I've kept it as absolutely easy as possible, so it shouldn't take too much time for you or a member of your team to complete. It does require sign off from a person in your organization who would be authorized to sign off on behalf of of your organization. And I'll put that QR code up during the question time so that if you want to get back to it, you can. So this is a small program at the moment. We do hope to expand it if it's successful, and if you once you all have provided some feedback and we can see where we can make improvements, we will be hoping to roll this out further, but there are only 7 places available this round. And so I do encourage you, if you're thinking of it, get in and get your expression of interest in, because yeah, you want to be on the cutting edge, and you want to be helping your patients and supporting those people in your community. Some of the technical or procurement related matters are that applicants must not assume their application will be successful or enter into commitments based on that assumption before receiving notification of the outcome of their application and confirmation from West Vic PHN. The expression of interest can be completed in about 10 minutes on the MS form, which again, there's a link there and the QR code will come up again later. As I mentioned, these slides, a recording of this session, and a link to the EOI can be found on the Western Victoria Primary Health Network website under EOI and grant opportunities. The expression of interest will close at 5 p.m. on Friday, the 11th of April. We wanted to get it closed before Easter because those few weeks are really messy, and we wanted to make sure that this opportunity didn't get lost in all of those fantastic family days off. All applicants will be notified of their results within 1 week of the closing date. So we will get through the review and back to everybody as absolutely quickly as possible. And one form can be completed for multiple practices. So if you are a group of practices with 5 practices that sit under one company name or one director, you can complete one form on behalf of all 5 practices. We just ask that you indicate if you have a preferred priority practice or if you only want to participate if all your practices can participate. Again, because of the minimum number of positions, and we just like to know what works best for you on that case. So next steps, the expression of interest officially opens at 12 o'clock today. We will then close that on Friday, the 11th of April. We'll notify you of results by 5 p.m. on Tuesday, the 22nd of April. And again, that will potentially flex depending on how available you all are during that Easter time. The initial scoping and planning session with PulsePoint Academy will be happening in May, or you'll be contacted in May to find out a time that works best for you and your team. And we'll be wrapping up the program by the 28th of November so that we won't be challenging people's time as we get close to the silly season. So we've adjusted for holidays in this program. Worth mentioning is that the learning modules that are being provided by PulsePoint Academy have been accredited by both RACGP and ACRM for 1.5 hours. And largely, if you haven't participated in some of our other training programs, what you'll need to do is we'll make sure that our workforce development team has your information, that you've completed the program and the sessions, and that will get uploaded to RACGP and ACRM, and then a certificate will be sent to you. You'll also be asked as part of the process to do an evaluation on the course. It takes about 5 minutes, and yeah, we definitely want to hear feedback on this. Now, also considering time, I did not mention a couple things, and that's that we are doing our very best to make sure that all reporting for this program is able to be done through your clinical information system. So if you're already sharing data with us through Coller, we're trying to ensure that any data that you want to be chasing up or following, and anything that would need to be reported during this program all aligns to that. So there shouldn't be any additional requirement for reporting. However, depending on the specifics of the program that you put together with Eugene and Dr. Coller, there may be some additional reporting. We can't make a blanket promise, but we're doing our very best to minimize that. Additionally, we encourage that a minimum of 3 people in your practice take on this program together. So do the learning modules and are aware of the program that you're pulling together, or the piece of work, the quality improvement activity that you're doing, because they become support for each other, and they also become knowledge bearers for the rest of the organization. But those 3 people can be made up of general practitioners, practice nurses, and other members of your team who would be supporting the patient journey and supporting a patient during heart failure and AF and their visits to your practice. We say we highly recommend that. I know there are some very small practices out there that that time just might be impossible. If you apply and you're successful, we'll do our best to work with you on that. But suggest at least 3 people in your team participate. Great. So there's the QR code again, and just a reminder of where you'll be able to find all of the details on this program. And now I would like to open it up for questions to myself, Dr. Coller, or Eugene. So feel free to raise your hand, take yourself off mute, type something in chat, whatever works best for you. But I will leave this up while we do that in case anyone wants to write it down or refer to it.
I'm happy to talk. I think that there is actually a question in the chat though, but
sorry, I can't see it.
It's from Lynn Husson. What criteria will applicants be assessed on?
Yes, and that is covered in the application. Largely, you need to be one of the general practices that operates within Western Victoria, so within our catchment area. We will rank additional points to your regionality or rurality, and there's a list of LGAs on the application of preferences. So if we have 50 applicants, preference will go to those in those general practices in those LGAs. And the rest is about your commitment and availability to participate in the program.
I can't see any other questions at the moment, so I might just jump in and just say, look, I think this is a really exciting program, and we'll be learning as much from the practices as we kind of providing in terms of educational support. I think it's a really it's quite a different approach to take, and I guess that we're really excited to see what the impact is. And, clearly what we learn from this journey together will also just inform us a little bit more about, where things, we're going to get a lot of insights, and there's lots of opportunities to really support the practices within their particular context, because we can't just say, all practices should, there are certain things that it's great to be providing, but we also need to be looking at what are the barriers in each particular professional context, like to actually providing that care, whether it's staffing, opportunities for education. And I suppose that, we're looking forward to having that, particularly that first scoping discussion around really engaging with what are the issues that you're facing on the ground. It might be something we haven't even thought about. So, we're really looking forward to actually, talking with people, understanding, because understanding is the thing that we need to be, building on is really just identifying those key issues before we can really kind of start to tackle them head on. And certainly we are happy to be guided as to what those issues are, and to really kind of particularly personalize the program that we're developing. And as Laura mentioned, really trying, not to put additional pressure on, that's why we've got our whole support team, and Eugene in particular with his quality improvement program background, to actually, really talk about, what's achievable. We certainly don't want to be placing a lot of huge amounts of extra pressure on a busy clinic. We just want to be working alongside to actually help the clinicians, help the patients as well.
Thanks, Jen. Eugene, did you have anything you wanted to add?
Yes. I think in addition, one of the other fantastic features which we're really looking forward to is that sharing between clinics. If at the end of this we had 7 different improvement initiatives that have been tried and tested in GP clinics, and there's opportunity for everyone to see what's worked and what's possible, feasible, and I guess that they have the power to shift. I think that would be a fantastic outcome. And I also, from my experience in the past, bringing together some of the local support service providers in one setting and sort of everyone getting a snapshot of what's really out there to support the patients is really valuable. So yeah, I'll just add to Jen's comments and saying that whole collaborative sharing side of the program is something that we're really excited about.
All right. Thank you for your time this morning. I do appreciate it, especially early, and it's already gotten to that part of the year where it's dark at the time we started and, fun. But I appreciate your interest in this program. I'm really looking forward to it because I see it as an opportunity for us to really support you to do the work that you want to be doing. And I like to think that's what we're here for at Westvic PHN is to help support you. Please do take the time to look at the materials this afternoon and get the right people involved with completing the EOI. If you have any questions or concerns, please reach out to myself, Laura Martin at Westvic, westvicphn.com.au. I will need to, for probity reasons, make sure that I post your question and the answer. I won't have to say who the question came from, but I will need to post your question and the answer to that question on the EOI and opportunities page for fairness for everyone else. But remember, if you've got a question, there's probably a couple other people at least who have the same question, just either didn't have the time or weren't in a space where they could ask it. So please feel free to reach out if you do have questions. And I hope to be seeing your application soon and calling you with some good news about participating in the programs. Thank you all again for your time this morning. Go get yourself some coffee before you start your busy day, and we look forward to speaking to you soon. Thank you.